Good day, everyone. Today I'm presenting our study Obesity and Diabetes in Children and Adults with Down Syndrome, data from a large diabetes center in the UAE. On behalf of my co-authors, Dr. Maura Moriarty and Dr. Nader Lesan from the Imperial College London Diabetes Center or ICLDC in Abu Dhabi, UAE. I declare no conflict of interest. Down syndrome is, or DS, is the most common chromosomal abnormality affecting 1 in 600 to 800 newborns. DS results from partial or full extra copy of chromosome 21. Intellectual disability, characteristic physical attributes, congenital heart defects, and higher incidence of some clinical disorders are some of its usual features. Common DS comorbidities include hypothyroidism and cardiovascular disease. Obesity and type 1 diabetes mellitus or T1DM are also known to be more prevalent in patients with DS than the general population. Available data on the prevalence of type 2 diabetes mellitus or T2DM in DS is scant. A study done in the UAE showed increased incidence of DS in Emiratis compared to non-Emirati UAE residents and globally. The incidence of DS in Dubai has been reported in 2013 to be significantly increased at 1 in 319 births. At ICLDC, around 80 patients with DS have visited and or is being seen. So this is the center, ICLDC in Abu Dhabi, and we also have branches in LA as well as in Zayed Sports City, which is also in Abu Dhabi. ICLDC is a one-stop, state-of-the-art outpatient facility specializing in diabetes treatment, research, training, and public health awareness. It opened in 2006 in partnership with Imperial College London as the first healthcare facility established by the Obadalah Investment Company. ICLDC has developed a tailored, multidisciplinary, holistic approach to the treatment of diabetes, endocrinology, and its related complications so that patients get the full spectrum of care they need all in one place. ICLDC is committed to a holistic approach to diabetes and its complications with research oriented towards a greater comprehensive understanding of the condition, its causes, and its treatment. For the objectives of the study aims to investigate the prevalence of obesity and diabetes mellitus or DM in children and adults with DS seen at ICLDC. This presentation aims to show the methods used in the study, the outcomes of the study, discussion points, some of them, conclusions, strengths and limitations of the study, as well as future Down syndrome research directions. So for our methods, individuals diagnosed with DS on the center's electronic database were included in this study. Information including weight, height, body mass index or BMI, diabetes status, and pancreatic autoantibody status were reviewed. Data were analyzed separately for pediatric group, age 0 to 19 years, and BMI percentile was computed and category matched based on Center for Disease Control or CDC standards. The second group is that for adults aged more than 19 years. And then data are presented as median range. For our results, we had a total of 77 subjects. The pediatric age group composed of 42 children and adolescents, with 18 males, and the median age was 12 years, weight of 36.3 kilograms, height of 1.3 meters, BMI 22.6 kilograms per m squared. And in this group, we saw 22 or 52.4% of overweight or obese, 6 or 14.3% had T1DM with positive gut antibodies, and 1 or 2.4% had T2DM. For adults, we had 35 in this group with 17 males, age of 25 years, weight of 73.6 kilograms, height of 1.5 meters, and BMI of 34.2 kilograms per m squared. So in this group, we had 35 or 100% were overweight or obese, 1 or 2.9% had T1DM with positive gut antibodies, and 8 had, or 22.9% had T2DM. So this table summarizes the results that I have just shown, both for the pediatric and adult groups. So pediatric, we had 42, adults, we had 35. And you can see also in this table that for obese alone, for the obese group alone, for the pediatric age group, we have 28.6%, while for adults, 74.3%. But again, when we combine overweight and obese, our adult group, the percentage of overweight and obese among the adults was 100%. Okay. So in this table, we can see that the adult cohort showed higher prevalence of obesity and overweight than other DS populations. On the left side or in the middle part, you will see that this comparison is from population in the USA, where we can see that among males, our DS cohort was 72%, while that for the USA population in the study was 45%, while for females, 76% versus 56%, while a study in England, that's with the 2 asterisks, the percent of overweight plus obese for males was 70.6%, while for us was 100%, and for females that was 95.8% in their group, while 100% in our DS adult group. And here in this figure is a comparison of the mean height and weight in the study population with DS, with adult population with DS reported in the USA. So you can see the circle in the figure, that's the other adult DS population female, while our DS cohort female is the rectangular one. And then for males, we can see the green triangle, that's for other adult DS population males. And our DS cohort is the X1 in males. And here we can see that male and female adults had marginal lower height and significantly higher weight than other population of adults with DS. We also compared the BMI of the DS cohort versus the general population. The general population is defined here as the BMI, average BMI of 100 adults per age group with normal glucose tolerance seen in ICLDC. So you can see on the x-axis the different age groups or categories that we compared the BMI with, and we can clearly see that the adult cohort indeed had significantly higher BMI than than adults without DS seen in ICLDC. These figures we are showing here the diabetes mellitus percentages in both the adult cohort in figure 3 and also in the pediatric cohort in figure 4. In the pediatric, in the adult cohort, as we have previously mentioned, we had 22.9% type 2 diabetes and 2.9% type 1 diabetes. While for the pediatric group, we had 14.3% type 1 diabetes and 2.4% type 2 diabetes. Okay, so this table shows the prevalence of overweight and obesity in children and youth with DS, which is actually a report from various publications. We can see here publications from 1988 up to 2015, yes, and also from various countries. And the pediatric cohort had comparable prevalence of overweight plus obese, which we mentioned was 52.4%, with other populations, that's 23% to 70%, as we can see on this table, reported globally. Also, we can see that the prevalence that we have observed in our pediatric cohort of 52.4% is quite similar with that observed in Saudi Arabia, which was 53%. Also, a report of a previous pediatric cohort study in the UAE, this was in 2015, was consistent with our results. So in this report, or in this article, they are showing that the children with DS were significantly shorter and heavier than normal children without DS in the UAE. For our discussion points, the prevalence of diabetes in the adult DS cohort of 25.8% was significantly higher than that of the general UAE population of 17.3%. The prevalence of T1DM in the adult cohort of 2.9% was comparable to that of the global DS adult population, which is 4.0%. The higher BMI in the adult cohort compared to the general population may help explain the increased prevalence of T2DM. And the pediatric DS cohort demonstrates a higher prevalence of overweight and obese children and adolescents compared to the overall pediatric population in the UAE. Additionally, rates of T1DM are substantially higher in this group. To conclude, although this study is not generalizable to all children and adults with DS in the UAE, our results support the need for aggressive weight management and regular medical examination among individuals with DS. The strengths of this study includes a considerable number of patients with DS seen in a single center. This report adds valuable information on obesity and diabetes, both type 1 and type 2, amongst individuals with DS. While for limitation, well, an obvious limitation of this study is that the study center is a diabetes clinic. Therefore, population may represent individuals with higher propensity to obesity and or diabetes, although majority of the patients had no known diabetes. Future directions for this study. More studies are definitely needed to further investigate obesity and diabetes in individuals with DS. In ICLDC, we are looking on a prospective study which aims to first establish a reliable register of individuals with DS with detailed information on various metabolic aspects of their condition involving obesity status, diabetes mellitus, body composition, lipids, relevant endocrine functions such as leptin, ghrelin, IGF-1, IGF-BP3, thyroid function, and also energy expenditure. And secondly, to investigate basic qualitative information regarding the cohort by using a questionnaire. With that, I'd like to thank you very much for your attention on behalf of ICLBC and our research institute. So this is our group headed by our clinical research head, Dr. Nader Lesan, on the middle. And the photo above is one of our team building activities. This one is when we went for Desert Safari. Thank you very much once again. And please feel free to ask questions or clarifications if you have any. Thank you.